Hi there, my name is Dr. James Walker. I am 60 years old, and I have spent more than 3 decades helping older adults understand their bodies. One of the most common complaints I hear in my office is night cramps. You know, that sudden tightening in your calf or foot that wakes you up in the middle of the night. It hurts, it scares you, and it makes you wonder if something deeper is going on. Most people think leg cramps are just a normal part of aging. But the truth is, for people over 60, especially those with heart disease, cramps can be an early warning sign that should never be ignored. Imagine your muscles crying out because they are not getting enough oxygen, rich blood, or because your body is running low on the very minerals that keep muscles working properly. These cramps are not just random. They are messages from your body, and if you listen carefully, they can tell you about the health of your heart, your circulation, and your overall balance. I often tell my patients that a cramp is like a smoke alarm. You can dismiss it as annoying, or you can take it as a signal that something dangerous might be happening inside. For older adults who already live with high blood pressure, clogged arteries, or a weak heart, cramps are often the first small sign that blood is struggling to reach the legs. That means the same blockage or weakness could be affecting the heart and brain too, leading to bigger risks like heart attack or stroke. And yet many people shrug it off, thinking it is just dehydration. While dehydration does play a role, the connection between heart disease and cramps is much more serious. So in this video, I want to walk you through the real story, why cramps happen, how the heart is involved, how medications and electrolytes play a hidden role, and most importantly, what you can do to protect yourself. By the end, you will see that leg cramps are not just a nuisance. They are a window into your heart health. And if you pay attention, they can save your life. Now let us begin by understanding how the heart and circulation work together and why that matters for every muscle in your body. To truly understand why cramps and the heart are connected, we need to start with the basics of circulation. Your heart is a powerful pump. It beats more than 100,000 times a day, pushing blood through a vast network of arteries and veins that deliver oxygen and nutrients to every muscle, every organ, and every cell. When the heart is strong and the vessels are clear, blood flows smoothly and your muscles stay nourished. But when the heart is weak or the arteries are narrowed by plaque, that flow slows down, muscles begin to starve, and cramps become more likely. Heart disease is not just one condition. It is a group of problems: high blood pressure, coronary artery disease, heart failure. All of them damage circulation in their own way. High blood pressure makes the vessels stiff and less flexible. Coronary artery disease clogs the arteries with fatty deposits, and heart failure weakens the pump itself. The result is the same. Blood struggles to move, and the legs, being farthest from the heart, suffer the most. This is why so many people over 60 notice cramps at night. When they are lying flat, gravity no longer helps blood move down to the feet. So if circulation is already compromised, the muscles of the calves and feet cry out with painful spasms. Many patients are surprised when I explain that a cramp in the leg is not so different from chest pain. Both are signs of tissue not getting enough oxygen. Chest pain is a warning of blocked arteries in the heart, while cramps can be a warning of blocked arteries in the legs. This condition is called peripheral artery disease, and it is common in people with heart problems. The real danger is that the same plaque causing cramps in the legs may also be clogging the vessels of the heart and brain, raising the risk of heart attack and stroke. This is why I tell my patients, never dismiss repeated cramps as nothing. They are part of the bigger story your circulation is telling. And understanding that story can give you a chance to act early. Now that you see how the pump and the pipes work together, let us look at another hidden reason cramps show up in people with heart disease: the role of electrolytes in the medications many older adults take every day. Now that we have seen how weak circulation can trigger cramps, let us look at another hidden reason: electrolytes and medications. Electrolytes are minerals in your blood and tissues that carry an electric charge. They include sodium, potassium, calcium, and magnesium. Without them, your muscles cannot contract and relax properly. When levels fall too low, muscles misfire and painful cramps appear. For many older adults with heart disease, the problem is not only poor blood flow, it is also the medicines they take every day. Drugs like diuretics, often called water pills, are prescribed to reduce fluid buildup and lower blood pressure. They help the heart, but they also flush potassium and magnesium out of the body. Over time, this loss creates an imbalance. The very pills that protect the heart can quietly set the stage for nightly leg cramps. I have met many patients who never knew that the burning pain in their calves was linked to their medication. Once we checked their electrolytes, the picture became clear. Potassium too low, magnesium borderline, and calcium out of range. Correcting those levels brought relief. It is not just diuretics. Other drugs like statins, used to lower cholesterol, can sometimes irritate muscle tissue and trigger cramps as a side effect. The challenge is that most older adults take several prescriptions at once, so it becomes difficult to know whether cramps come from poor circulation, from electrolyte imbalance, or from the drugs themselves. Often it is a combination of all three. That is why I always encourage older adults to talk to their doctor about every new symptom, even if it seems small, because small clues like cramps can help us adjust medications or add supplements in time. Many times a simple blood test can reveal the missing link, and fixing it can make a world of difference. As we connect the dots, you can see that cramps are not random. They are telling you something. And if we listen carefully, they point us to the heart, the blood vessels, and the chemical balance of the body. To bring this closer to life, let me share with you the story of one patient, an older gentleman whose experience shows how cramps can be the first clue to something much larger. A few years ago, I met Robert, a 68-year-old retired teacher. He came to me because he was waking up almost every night with painful cramps in his calves. At first, he thought it was just age, maybe dehydration, maybe too much gardening, but the cramps kept getting worse, sometimes forcing him out of bed to pace the floor until the pain eased. When I asked about his history, he mentioned high blood pressure and mild heart failure. He was also taking diuretics and cholesterol-lowering medication. As soon as I heard this combination, I suspected more than simple fatigue. We ran a few tests. His blood work showed low potassium and magnesium, classic signs of electrolyte loss from water pills. But that was not the whole story. We also checked the circulation in his legs using an ankle brachial index test. The results showed reduced blood flow to both calves, a sign of peripheral artery disease. In other words, his cramps were not just muscle problems. They were signals from his body that his circulation was struggling and his heart was under strain. Robert was shocked. He told me he had ignored the cramps for months, thinking they were harmless. In reality, they were warning him about a deeper problem. We adjusted his medications, added supplements for potassium and magnesium, and worked with him on a walking program to improve circulation. Within weeks, the cramps became less frequent, and more importantly, he gained a clear understanding of what his body was telling him. Robert's story is one I often share because it shows how a small symptom, like night cramps, can reveal much larger risks, and when addressed early, can change the course of health. His experience reminds us that ignoring cramps is like ignoring chest pain. Both are red flags that deserve attention, and both can lead us to life-saving interventions. If we act quickly as we move forward, let us step back from Robert's story and look at the bigger picture. What are the warning signs that tell you cramps are not just random, but a serious signal connected to your heart and circulation? So how can you tell when a cramp is just a minor nuisance and when it is a serious warning? There are certain red flags that I always tell my patients to watch for. First, frequency. If cramps happen more than once or twice a week, especially at night, they should not be ignored. Second, duration. A cramp that lasts more than a few minutes or keeps coming back during the same night can signal something more than fatigue. Third, location. Cramps that consistently strike the calves or feet in someone with known heart disease or diabetes are often linked to poor circulation. If the cramps are accompanied by cold feet, pale or bluish skin, or slow-healing wounds on the legs, those are strong signs of reduced blood flow. Another warning sign is when cramps appear during walking and ease with rest. This pattern, called claudication, almost always points to blocked arteries in the legs, which is directly connected to heart health. In fact, the same plaque that clogs leg arteries often clogs the coronary arteries as well, leading to heart attack risk. I also warn patients to pay attention to cramps that come with swelling of the ankles, shortness of breath, or chest discomfort. In these cases, the problem may not just be the legs, but the heart itself struggling to pump efficiently. When these signs show up together, it is time to see a doctor right away. Many older adults brush these symptoms aside, thinking they are just part of aging. But the truth is they can be life-saving clues. Just as Robert discovered, catching these early can change the outcome dramatically. So the rule is simple: if cramps are persistent, painful, or paired with other symptoms, treat them as a message worth listening to. In the next part, we will shift from warning signs to solutions, exploring the lifestyle habits, nutrition, and daily practices that can reduce cramps, support circulation, and protect your heart as you age. When it comes to prevention, the good news is that small daily choices can make a big difference. For older adults facing both heart disease and cramps, lifestyle is not about perfection. It is about consistency. The first step is hydration. Muscles need water to contract and relax smoothly. Dehydration thickens the blood, strains the heart, and makes cramps more likely. I advise my patients to sip water throughout the day rather than drinking large amounts at once. Adding a slice of lemon or a pinch of electrolyte-rich foods can help. The second step is nutrition. A diet rich in potassium, magnesium, and calcium supports muscle and heart function. Bananas, sweet potatoes, leafy greens, yogurt, and almonds are excellent choices. I often remind patients that food is medicine, and balancing electrolytes through diet is safer than relying on supplements alone. The third step is exercise. Gentle movement keeps blood flowing. Walking, stretching, or even light cycling helps strengthen the muscles and improve circulation. For those with peripheral artery disease, a supervised walking program can actually train the vessels to open up and supply more blood. Stretching before bed is especially helpful. It relaxes the calf muscles and lowers the chance of night cramps. Another important piece is footwear. Supportive shoes improve circulation and reduce muscle strain, and let us not forget posture. Sitting for long hours without moving slows blood flow. So I encourage my patients to stand, stretch, and walk every hour. Lifestyle also means managing stress, because stress hormones can tighten blood vessels and trigger spasms. Relaxation techniques, like deep breathing or gentle yoga, can reduce this burden. Sleep position matters too. Elevating the legs slightly can help venous return and prevent cramping. Finally, never overlook the role of medical guidance. Adjusting medications, checking electrolytes regularly, and having routine heart evaluations all play into prevention. These habits work together like pieces of a puzzle. Each one supports the others, and together they create stronger circulation and calmer muscles. Now that we have seen how prevention works, let us wrap everything together by looking at the bigger picture, the connection between heart health and cramps, and why paying attention today can protect your independence and quality of life tomorrow. As we come to the end of this journey, I want you to remember one thing. Cramps are not just about muscles. They are about messages. Your body speaks to you in small signals, and cramps are often one of the earliest signs that circulation, electrolytes, or the heart itself needs attention. In younger years, you might dismiss a cramp as nothing, but after 60, especially with a history of heart disease, every cramp deserves a second look. We have seen how poor blood flow can starve the muscles, how medications and electrolyte imbalances can tip the scales, and how one simple symptom led Robert to discover a deeper heart issue. His story shows us the power of listening. The truth is, prevention is always better than emergency. By staying hydrated, eating foods rich in potassium, magnesium, and calcium, keeping active, stretching, and working with your doctor, you can dramatically reduce cramps and improve your heart health at the same time. The connection is clear. Healthy circulation means fewer cramps, and fewer cramps mean a heart and body that are working together. So if you are over 60 and you find yourself waking at night with that familiar tightening pain, do not ignore it. See it as a gentle alarm, a chance to protect your legs, your heart, and your future. I have walked with thousands of patients through this path, and I can tell you, those who pay attention to the small signs often avoid the big disasters. Your independence, your ability to walk freely, to sleep peacefully, and to live fully depends on choices you make today. So take this message seriously. Talk to your doctor, share what you feel, And do not be afraid to ask questions. Cramps are not the end. They are the beginning of awareness. And with awareness comes strength. Thank you for staying with me. I am Dr. James Walker, 60 years old, still learning from every patient and every story. And I hope this message gives you the tools and courage to listen to your body and protect your heart. Because at the end of the day, your health is your greatest gift, and you deserve to enjoy it for many more years to come.